Excellent. Welcome, Mountain Mamas. This is our monthly Zoom meeting. This month we're learning about medical emergencies for first aid. So if you are ever in the mountains and someone is having issues and it hasn't been related to a traumatic event, then that's considered a medical emergency. And we're going to go through, I think, like six different options, six different scenarios and illnesses that are just the good things to just keep in mind when you're taking care of women out in the mountains and or just out in the mountains. So the first one is abdominal pain. And abdominal pain is so vague. And there's so many organs in here that it's just really tricky to like diagnose something. As nurses, we learn like the four quadrants, and like if it's up here, it's appendix, and down here it's the gallbladder, and over here it's the rectum, and But honestly, what you need to know is just if someone's been having pain that's been associated with shock, like they're in shock and we have no idea what's going on with them, but they're having abdominal pain, that's something we want to evacuate. And we want to evacuate someone who has abdominal pain longer than 12 to 24 hours, which you can imagine you would be hearing about that from women. We want to hear, you'd want to evacuate if it's the localized pain, or if you're having abdominal tightness, or things are starting to swell. I want to pause right there. You can imagine all the scenarios that could be going on. So we could have a various organ that's infected, like a gallbladder or an appendix or things like that. You could have an infection in the bowel that could be getting necrotic. If someone has a poop for a long time, that constipation can actually become very, very severe and get infected and things like that. If something's happened and we don't know and they are hemorrhaging, they're bleeding from inside, you'll notice that distension and that tightness in the abdomen. You'll also notice some bruising and things like that. So that usually accompanies a traumatic injury. But if something, they're not verbalizing things to us, that's something else we're also worried. Like something may have ruptured inside and is bleeding and fluid or whatever is coming out. So yeah, we want to watch out for tenderness, abdominal rigidity, and distension is another thing. I think I've got a list of 8. So this will be number 4. If they're throwing up blood, and the interesting thing about blood in your GI tract is it'll change color depending on where it is, and it can kind of help pinpoint where you think the bleeding is. If they're throwing up blood and it's red, bright red, then likely they're having bleeding somewhere in their mouth or their throat, back of their throat. Something is going on here. If it comes up coffee ground color, black coffee ground color, it likely that has been digested blood, and that could be coming from the stomach. So there could be an ulcer or something else going on in there. If they're having stool that's black, and you should know, ladies, I'm going to have this all online, the whole outline, Lori, because I see you're taking notes. You're amazing. I'll have this all typed up for you guys. I'll send it after our meeting. But the stool, like if they have stool that's black and tarry, that's also the same idea as that coffee ground bleeding, that it's blood that's been gone through the GI tract. So that's likely an upper GI tract bleed. Something up there is bleeding and has been digested, and now it's coming out as tar and black stuff. Also, if you're seeing black stool, ask the woman if she's on iron, because if she is, that might be why it's black, and it's not because she's bleeding. Just a good point. If you have bleeding coming out of the stool that's bright red, that means it's near the end of the bowel. So it's probably in the rectum or right near at the bottom. That's likely hemorrhoids or something like that, not life-threatening. But if it continues, then that's something that we definitely want to address. So that's blood in the vomit, blood in the stool, and then blood in the urine. If you're having abdominal pain with that, the urine is going to look like pink, maybe amber colored, a little reddish. It's hard to tell in the mountains when someone is peeing what color their pee is, honestly, unless you're peeing in a bottle, like you would have no idea. But if you're actually seeing blood coming out when someone's urinating and they're not on their cycle, then that's something you'd be concerned about. Also, if you have abdominal pain with nausea and vomiting and diarrhea, any of those 3 that last longer than 2 days, 2 or 3 days, So you're thinking your biggest concern is that they are throwing stuff up, stuff is coming out the end, and they're not hydrating back up, but not getting stuff back in. And so they're going to start having weird electrolyte imbalances, and that's going to cause a host of other problems. So if someone's throwing up, if we're just doing a day hike or something like that, someone throws up, that's not such a big deal. But this is if we're having a 2 or 3 day activity or something like that, and someone's just super screwed up. We want to get them out after it's been a day or so, just because they're just going to be so dehydrated. If they're not able to replenish that, that's something that's concerning, especially if it's accompanying abdominal pain. And then if we have abdominal pain that's linked with a fever higher than 102 is usually the rule of thumb. I honestly get worried over anything over 100. But that means there's an infection going on. And so something has burst or is leak. There's something going on that's causing an infection. And then pain associated with pregnancy. I would think, because we have only women, that anytime someone's having abdominal pain, the first question you ask is, are you pregnant, or do you think you could be pregnant? And that's a huge, because if there is any sort of pregnancy, if they're pregnant, or there's, especially if they can confirm pregnancy and they're having abdominal pain, we just get them right out. They just need to go see a doctor, because we cannot deal. We don't know. There's a million things that could be going on. I mean, they might just have an ulcer and say, I'm fine, but because they're pregnant, we still got to get them out. And then pain with walking. If every time they take a step, all of a sudden they have sharp pain in their abdomen area, we also want to take them and evacuate them. So abdominal pain is something that you just want to have on your radar, that if it's not resolving, that it's something we're going to actually evacuate. We don't treat very much in the field because there's so many things that could happen. So that is something that we will try and evacuate. And when you're evacuating someone with severe abdominal pain, for whatever reason, we want to do it gently and have them in a position of comfort. We try not to have anything by mouth generally, but they could have little sips of water, just because likely if something's going on here and they go to the hospital, there could likely be a surgery that's involved. So we don't want to give them food or water prior to anything that could be a surgical intervention in the near future. Anyway, so that is abdominal pain. And I would say, when you're treating any woman with abdominal pain, just because we're women, ask them what cycle day they're on. Like, that is a really good thing. If we're having abdominal pain, or if it's just lower pelvic pain, there's a million reasons. So, we could have, it's the first few days, of course, it could be cramping. It's in the middle, that could be, you have those cysts. And, if a woman has a history of cysts or things, there's just lots of little pains that we can get through our cycle. And so it's good to kind of know where about a woman is on her cycle. That can rule out some things too. So anyway, abdominal pain. Do you guys have any? I'm going to ask questions at the end, but if you do have a question at the end of a section, then go ahead and put your hand up and we can address it. So no questions. Okay. All right, excellent. Second, we're going to talk about allergic reactions and anaphylaxis. So allergic reactions can come from anything we eat, that comes on our skin, that we breathe in, any way our body can absorb something. And a lot of times we're going to just have allergic reactions. It's going to be a stuffy nose. We'll have itchiness, swelling, hives, swelling not in the facial area, like just a little hive or something like that. We've all probably most people have had an allergic reaction to something in their lives, even if it's just mild. So that's something we actually ask the women to report on their medical information, whether they do it or not. Some gals do, and I'm super excited and glad they do. But that's something to kind of keep on your radar and ask people if they're having those kind of symptoms. Now, for mild symptoms, of course, we're going to do something simple like, we're going to do like a Benadryl or something like that. We have Benadryl in all our first aid kits. And so that's something we can just give a lady, 25 milligram, 1 tablet, maybe 2 if she needs a little extra. But the thing we're really watching for her is to see if it's going to progress into something. If this is something that's like, it's an allergic reaction to something that lists as an allergy, then that's something we take seriously. So a severe allergic reaction would be something that could actually produce shock, where someone starts to kind of like get lightheaded and feel like they're going to pass out. If they start, of course, have difficulty breathing, that's a huge thing we're worried about. And of course, swelling in the face, lips, mouth, all this kind of stuff. Any swelling here, we are just getting them. That's something that's in a total emergency. Sometimes they'll get swelling in their hands, their feet as well. And we're even still worried about that. So the treatment for that, I'm sure you guys all know, anyone who's had a reaction that has caused a severe allergic reaction likely has an EpiPen on them. And that's something we really want to ask gals, you know, is this allergy something that you carry an EpiPen around with you? And that's something we do a week before every trip. If a woman has declared that she has allergies, we ask her about, you know, how concerned are you about this? If it's just an antibiotic, I'm not as worried. If it's a plant or an animal or something else that we're a little more concerned if we're going to be in an area with that kind of thing. If it's a food allergy like nuts or something, or bees, super worried about bee allergies. Then we really want the women to bring an EpiPen with her on the trip. If we're doing something overnight, or especially multiple nights, we actually want them to bring 2 EpiPens. Because likely, especially if we're someone far in the mountains and they have an allergic reaction, say like they got stung by a bee, we give them the EpiPen. They're gonna, in a little bit, like the EpiPen will work for a while. I don't know, I can't remember, it's 15, 30 minutes, but after a little bit, it's gonna come back again. So we want to prepare with the second EpiPen if we have that available. And now also, just another common thing is if you have to administer an epinephrine injection, as soon as that mouth and airway is open and safe, you can give them a Benadryl. And that's just a good standard to do. So EpiPen, and then just know, and then I'm going to give them a Benadryl, just because we've got to get that person evacuated, and we want to keep these airways open as long as possible and as easily as much as possible. And another, just a note with EpiPens, if it's super hot or super cold, they can get ruined. So it'd be something, if you know anyone who's bringing an EpiPen on a trip, to wrap it up in a coat or something like clothing or something to keep it insulated and protect that medication. And that's it for allergic reactions. Honestly, if everyone has an anaphylactic shock or anaphylactic reaction, we are going to take them to the hospital. We're not going to just be like, wow, that was awful, good for you, you know. So just know that. All right, questions on allergies. Yay. A lot of our gals are going to have just topical allergies, rashes and stuff like that. So we do have some Benadryl ointments and creams, and those women hopefully should know, be aware of that, and be able to bring that and have that with them. You know, if we all run through poison oak, poison ivy, we have poison ivy here, we have stinging nettle here, and those kind of things you'd want to rinse with water and wipe off. If it's a poison ivy, by the way, that's just an oil, and you just got to wipe off the oils and stuff. But that's in another lecture. We'll talk about that. All right, now we're going to go to asthma. I have asthma, and I think asthma is probably the leading medical condition that women report in their medical forms when they fill out their trip reports. Asthma, most of the time, is just going to be a mild case. So what it is for whatever reason, whatever triggers the asthma, whether it's an allergic reaction or it's exercise induced, or for me, it's fuzzy animals, that your respiratory, your lungs, your bronchi, your bronchi, your throat, your lungs, all your airway passages just close down. And then it starts to produce all this mucus, which is lots of fun. So you see asthmatics and they're spitting all over the place. It's awesome. But and then what happens is when it closes down, it traps all that air in your lungs. And so when you breathe out, you'll wheeze. So that's a classic sign of someone who has asthma, is that they have wheezing when they breathe out. A lot of times it's just a mild case, and all that you have to do is just calm them down, stop them from exercising, calm them down, and do some nice breathing. And a lot of times that's going to be okay. A lot of gals, I think only half the gals actually end up bringing medication, inhalers, because they say their asthma is super easy and mild and well controlled. So I would say that's most of the thing most we can do. We learned a tip on another trip where one of our asthmatics said, if you put your arms above your head like this, that actually opens up your lungs and really helps with breathing and helps people who are going through like a mild attack. If you're having a moderate attack, you definitely need to use your inhaler. And there's a couple different inhalers. There's a rescue inhaler. It's called Albuterol. And it's, I should have got mine. But anyway, it just comes in a little inhaler, and they need to shake it, breathe out, and then pump it while they're breathing in. It's going to shoot the medicine to the back of their throat, but some of it will get down into their lungs, and they need to hold their breath for 10 seconds to let that medicine percolate. and then take a breath out and breathe regularly for about a minute. And then they take the second puff. And the second puff is actually what's going to do the work. It's going to actually, hopefully by then, the top airway passages have opened, and now that second dose can get deeper into the lungs, and that'll really open up their lungs and make things a lot better for your patients. So asthmatics need to take 2 puffs with 1 minute in between if they really want to have some good results. And then of course we want to keep them calm, breathing well, nice to relax. If someone who's going through an asthma attack does not get relief by that your inhaler, they need to be evacuated, and you need to do it nice and slow. We've learned this on some of our trips. So take our asthmatics calmly and slowly, just helping them breathe slow. I've had like a moderate attack before and have been able to relax and breathe through it. Not that I recommend not using medication, but just know that like the tightness and the anxiety also contributes to an asthma attack. So keeping them calm is very, really good. So yeah, so that is our asthma. If you do, you can also, if they had to go to the hospital, they will use epinephrine, which is like an EpiPen, to help open up those lungs a lot too. And then you can also give them water as long as they're not going to choke on it, because that water actually helps break up the mucus and keeps those passages open a little bit more. All right, so that's asthma. Any questions on asthma? Erica? Just kidding, you're black. I have no idea what you're doing. Okay, diabetes. So diabetes is another one that I'm really, we always want to keep on our radar. If anyone in our groups or anything has diabetes, that's something you really, really want to keep a close eye on. And you'll always be like, do you have your little sugar, your little glucose tablets or whatever on you? And they're like, I got them. Just so you know, in all our first aid kits, the lead guide we'll have a first aid kit that has a little thing of glucose in it. Essentially what it is cake icing. It comes in a little tube. And what you would do if somebody is having a hard time, usually the signs and symptoms for low, so there's 2 kinds of sugar. There's a low blood sugar, hypoglycemia. That's the one that's deadly. And that's why no matter if someone's diabetic, and we don't know if their sugars are high or low, they're just someone who's diabetic who's just not looking good, just always give sugar. Always give sugar. Because we don't care if they're high and we make them a little higher, it's not going to be the end of the world. But if they're low and we don't do anything about it, it's fatal. So yeah, if they, we just do the glucose. I would just recommend this more than hard candies. If someone's kind of a little unconscious, they're just a little wacky, we don't want to put any hard candies or anything in their mouths. And sometimes, if they're awake enough to do a juice, like an apple juice or something that's super sugary, that's fine. But the glucose gels we really like, because even if they're unconscious, we can get that, rub it on their gums and put it under their tongue, and it'll be absorbed through their mouth. And things can be absorbed through your mouth in as little as 15 minutes. So it's a good option to have. So anyway, that's going to be in our first aid kits, and that's available. So you have a woman who is hypoglycemia or glycemic. It's usually because she's been exercising really, really hard and hasn't been eating to supplement that. So you're going to start seeing shakiness, confusion, hunger, pale skin, and then she'll eventually pass out, and then she could eventually die. So those are the things that when we're starting to see someone a little shaky and they're just not seeming right and they're diabetic, then just go ahead and make sure they've got sugar. Stop them and get sugar. We're going to sit with them and calm them down. If they have their glucometer and can check their sugars while they're there, that's awesome. I don't know many diabetics who actually bring their glucometer with them, but that would be nice if they did. And then we can make sure they're okay. A normal blood sugar range is usually 80 to 100 60 to 100 in a regular person. A lot of diabetics, they keep them a little higher, like 80 to 120 sugar. So if you're getting below 60s in your blood sugars, that's bad. And if you're getting high, it could be like 200 plus. I don't know. I am a nurse and I have patients have like 500s. That's when we call the ambulance. But yeah, essentially we want to keep them 60 to 100 is a good range. Then if there's somebody is hyperglycemic and they have high blood sugar, that's when we want to take, that's when they would usually be taking their insulin. They just haven't taken enough insulin and they're just not feeling so good. So you're going to see that they're tired, they're thirsty, they're peeing a lot, they're super thirsty. They have or dehydrated. They have a fruity odor on their breath. I don't know how many people who get that close to people's breath to smell that. I've never smelled that. But eventually that can lead, if their sugars are super, super high, they'll start getting super confused and they can go into a coma. So it's not the best thing either to be really high. So we want to keep an eye on that as well. If someone's diabetic and they're just not looking good. So the treatment for high blood sugar, we want to give them fluids. And if they have their insulin with them and can administer it to themselves, that's great. We cannot administer insulin to people unless you are a doctor. Maybe as a nurse, I might, but it's still a sketchy area. So there's just a really high chance that you could give the wrong dose and then that drops them and then that kills them. So we want to be super careful with insulin. So a lot of times people who are diabetic will not have their insulin with them on hikes. So they just have their candies and their, juice and stuff like that. So anyway, that's your diabetics. Questions? Everyone's got their hands just kidding. There you go. Okay, everyone's good. All right, next we're going to move to heart attacks. So we are women and heart attacks is kind of a little pet. I don't know, pet peeve. It's not a pet peeve. It's a little soapbox for me. So if you ask someone, well, first off, a heart attack is when you're not getting blood flow to your heart, and so your heart hurts because it's starving for oxygen in that blood. So that's why you're getting the pains and things, and that's essentially what a heart attack is. You have a blockage in the blood vessel in your heart. So women don't, so your classic things when you think about a heart attack, someone's having a heart attack, is they're having chest pain, shortness of breath because I'm not getting enough oxygen, and my body, that's the way my body is trying to cope. I might have pain down my left arm, numbness, tingling, just weird feeling down this left arm. A lot of women, maybe half the women present with those symptoms, the classic symptoms. A lot of times women will present with other symptoms. They just get tired. You could have a woman who's just tired and has some low back pain and she's having a heart attack. It's so freaky. She just can't catch her breath. She's sweating a little bit, things like that. So if you've got a gal, if they let you know, if they've got, if anyone reports that they have some any sort of medical heart history, we'll let you guys know on our trips. But just keep that on your radar, like especially in gals over 40, which I feel are like half of us, that could likely be something that's going on with them. So just keep a close eye. If you got a woman who's presenting with shortness of breath and is tired, that could be asthma, that could be a heart attack, that could just be she's tired, that could be diabetes. You can see how it can be all these things. Or it could just, she just, hiked too fast. So we want to really keep a close eye on what's going on with these people and ask them, do you have any medical history, anything, any heart things, any diabetes, respiratory things that could be causing these things? And that might help us get into a good direction. But obviously, if it's not getting better, we get that woman out because you guys aren't doctors. So you just, go with your gut. So if we have a woman who's having some symptoms, and especially if they're the classic symptoms, even pain going up to her jaw, that kind of thing, we want to make sure we calm her down, get her in a position of comfort, keep her warm, and give her a half tablet of aspirin, just those baby aspirins. It's a blood thinner, and it helps if she's having a clot that's in that heart, might be able to help just thin it out a little bit, enough for blood to get through to that heart and keep that section of her heart from dying. Obviously, we're not going to have this gal hiking anymore. We want to keep her calm and sitting down. And if she does have nitroglycerin, we'll let you guys know if someone's got needs to have. We will be bringing nitro on a trip. But if she has nitro, then you can put it under her tongue and you keep it there for 3 minutes. Then see if it gets better. If it doesn't get better, then after 5 minutes, you can give another one, and you can give up to 3. So just throw it on, wait a few minutes. Chest pain's getting better, not better. Okay, give you a couple of minutes, and then we're going to give you a second one, and then you can wait another 5 minutes and then give a third one. So yeah, so that's the best idea. If someone's got really bad chest pain, like angina, they should hopefully have that with them. All right, so that is heart attacks. Let's hope we never have those. And then there's CPR. That's another one we covered. So
can I ask a question about the heart attacks?
Yeah.
Would you call an ambulance at that point, or just kind of see how they
Oh
are?
my gosh. Yeah, I would
with
say
the nitrogen or whatever that stuff you put under their tongue.
With nitro, I think on one of our trips, we would, just because we're so remote. So if we're like, if you're in a hike and someone starts having chest pain, she actually had nitro on her, and she took a nitro, and she starts to feel better. That's someone I still want to take. I'm going to hike them out to the trailhead, see how they're feeling, and I would strongly encourage them to go to the hospital and be checked out. Because there's a lot of stuff, because likely that if there's a clot that's in there and they took that nitro, and then what the nitro does is it opens up the blood vessels, so it allows blood to get through. It's gonna wear off, and if that clot or whatever is still there, she could still be at risk for having more chest pain and other cardiac issues. So we would want to have her checked out. If she refuses, she's like, I have these all the time. I don't know. I have geriatric patients that are 80 plus, and they tell me that all the time. Like, I'm just working it through, I'll be fine. That's her own prerogative. But what we want to make sure is that we are encouraging her to go see the hospital, go to the hospital, get checked out. Yeah.
So you would just hike her back down the trail, not have life flight, or I'm just wondering how, I don't know.
That's a tricky question, because you don't want her to have a lot of exertion. You would want to sit her down and have her be calm. If she has any medication, give her nitro, give half a baby aspirin, and let her sit it, wait it out and see how she's feeling. And then I would see if she could tolerate exertion, if she can tolerate walking, and we don't have that far to go, then I would say, yeah, let's go ahead and try and slowly make our way down. If you're at the top of Timp or something like that, and you're like, oh my gosh, we have 8 miles, and this woman barely made it here, and she's been having chest pain this whole time, and just now decides to tell us, that I would say that was something you would life flight. So you just kind of take things into consideration on your evacuation, because we don't want her. I mean, the worst thing is, like, they're having a heart attack, they've taken some medicine, they're feeling okay, and then we start to exert and throw that blood pumping through that heart, and then it all just gets much worse. So yeah, but it's a hard thing, because you're like, if we don't get them out soon, maybe they're going to have another attack. So it's a decision you have to make up in the field. Yeah. Good.
What exactly is nitro?
Huh?
What is nitro?
Nitroglycerin. So they come in a little bottle. They're little teeny tiny white pills. What they do is, when you take them, it opens up every blood vessel in your body. Like, it just shoots them all open super fast. So if you're having a heart attack, it opens all those blood vessels and allows the blood to go through to your heart. And now it has oxygen in that part of the heart, so it doesn't hurt anymore. Yeah, great question. Okay, cool. Yeah, a lot of these things, Lori, is going to be, you do the best you can, and I don't know, say a prayer and have wisdom, and treat what we can in the field and get them out as safely as we can, whatever that means. So hyperventilation. So this is a situation where someone is super anxious, scared, something like that, and they start to hyperventilate, and they're breathing really, really rapidly, and they start having tightness in their chest. And because they're breathing too fast and they have this tightness, the oxygen is not getting to the places in their body it needs to. And so they'll start to have numbness and tingling in their hands and their feet. Their hands and feet could start spasming, and then they're eventually going to pass out, because they're not having oxygen to their brain, and their body's just like, for crying out loud, like, they're going to pass out. And when they pass out, they could actually stop breathing for a little bit. And so if that's happening, you want to keep an eye on that. Do some rescue breaths every few seconds, and just kind of be there with them, and then hopefully help them when they come to. Now, something, if they're starting to kind of get in that zone and we're trying to calm them down, the best thing you can do is just calm them down. Whatever's causing their anxiety, whatever, we're going to just talk in calm voices, and we want to breathe with them. Just say, I want you to breathe with me. And a lot of times I have to get into people's faces like this and be like, look at my eyes, and we're going to breathe together. We'll breathe together. And sometimes I'll put my hand on their chest and just be like, together, we're breathing, and you just want to focus everything in super close and just focus on this moment, and then really try and bring those breaths down and calm them down. Sometimes it's because of pain. They're having severe pain or whatever, and if there's other things that we can help with, we'll try and take care of that as well. So we would give them some pain medication or things like that. But yeah, so just know hyperventilation can lead to totally passing out. So we want to watch out for that. All right. Any questions on that? Good. Cool. All right. Seizures. So this is, hopefully someone would let us know if they have a tendency to have seizures. You can have seizures for many reasons, but if it's something that you have as this neurological illness you've been dealing with chronically for your whole life, then hopefully they're going to let you know, and they're going to have medications with them. If someone has a seizure on a hike or any of our activities, whatever, there's a lot of, what we want to do is keep them in a safe, if it's a real seizure, it only lasts about 2 minutes. And their body is just like, it's their brain, the brain is just misfiring, and that's what's happening. And there's many reasons why your brain could do that. Sorry, really cute little, anyway, so there's many reasons that could be happening. So we want to, when they're going through a seizure, usually the seizures you think of are the grand mal seizures. So I'll go to that. Grand mal seizures are the ones that are dangerous. And the reason is they're just arms and head, and they can fall into things. And so we want to protect their head. If you're standing next to someone who's having a seizure, you'd want to support them, especially their head, their neck, and guide them, if there's a couple of you, and you can kind of hopefully guide them to the ground, to a safe place on the ground. They're going to be shaking and stuff. And, if you want to gently support their head, that's fine. If they're going to hit rocks or things like that. We just don't want to put anything in their mouth, like that misnomer of putting a stick in their mouth or strapping them down. Like, those are bad things we do. We don't want to do that. We just want to kind of support their head and keep them safe, spread everything out, and make sure they're not going to hit anything, and just let them ride it out. And it's totally fine. And when they are done with their seizure, they're going to be super tired and just not quite, really disoriented for a while after. And that's okay. We want to give them some privacy. A lot of times they're super embarrassed. A lot of times you get incontinence of bowel and bladder, and that's no fun. And so you want to give these people some privacy to kind of like come to and kind of get back on their feet again, and things like that. And then, I would talk with them. Usually if someone's had a seizure, we'll probably just walk them out, and then let them know they can make the decision. I don't know how often these happen. If it's never happened to them before, then obviously we want to tell them to go to the hospital. If this is something they're just like, oh, I would let them make that decision, but obviously not let them drive home. So we want to get them back to their home and make sure they're safe and things like that. So that is seizures. Questions?
Can we talk about the wooden spoon in the mouth?
Yeah, no wooden spoons in the
Yeah,
mouth.
that was like up till about 5 years ago. Every movie, they would always have that on there.
Don't take medical advice from movies. Bad idea. All right. Okay. I forgot to tell you guys, I'm an RN. So some of this comes from my own experience. I'm a hospice RN though. So just saying, I'm not an ICU. I did some time in the ICU, but anyway, currently. Anyway, so that is it for medical emergencies today. You should know that we get all our information from these medical first aid clinics that we do from an awesome little book. It's the First Aid Backcountry Guide by Buck Tilton. Anyway, it's a little, all our first aid, all the Mountain Mama first aid kits have these little books in there. So if you're on any trip and anything happens, you can pull up that first aid kit, pull up the little book, and it's going to tell you exactly all the stuff we teach you in all these clinics, and keeps it really simple and easy to get to understand. And that book is a summary of the Wilderness First Responder course that we took. And so it's got all the first responder stuff just consolidated into a little book. So anyway, so we have those resources for you out in the field. So that's it for medical emergencies today. And Ms. Mudd, I'm so glad to have you here. And yes, questions.
Lori, did you have a question?
I was just wondering, like, do you have these kind of medical emergencies very often? Are they, I mean, I didn't think so, but I just thought I'd check.
Wow, our women are pretty awesome, and I'm hoping that they're honest in their reporting of their medical conditions, though I'm sure they're not. But yeah, and we've been doing Mountain Mamas for 6 years and have had one incident, and that's been Marilyn, who fell on Timpanogos, and not her own fault. I mean, it was just crumbled under her foot and tore her.
I just messed up my ankle.
So we want to just make sure that as we're going forward, we're having more women, and a lot of women, this is their first time, so we're not very familiar with their health conditions and things. And so we want to be prepared in case anything happens.
Okay.
Great question. Mary, did you have a question? No? Okay. Awesome. Yay. Well, thank you guys so much for joining us on this Zoom meeting. And we're going to take a few-minute break, and we'll be back for the second half. Just do the same password and all that sort of stuff. We'll see you soon.
So we need to leave this meeting and come back into it.
Yeah, I'm gonna end
Okay.
this meeting. You can probably stop the recording right now. Okay, or that.